Here's something most people don't find out about until it's too late. Medicare is not automatic. It is not free. And it does not cover everything you think it does. If you're within 5 years of retirement and you have not taken the time to understand how Medicare actually works, you could be looking at hundreds or even thousands of dollars in unexpected costs every single year. I'm Shonda Prescott, and on this channel we simplify retirement so you can stop guessing and start planning with confidence. Today we're going to walk through Medicare 101, what it is, how it works, what it costs, and the 3 biggest mistakes you absolutely need to avoid before you turn 65. Let's get into it. So let's start at the very beginning. Medicare is a federal health insurance program designed primarily for Americans who are 65 and older. It also covers certain younger individuals who have qualifying disabilities or specific medical conditions. But for most people watching this video, the magic number is 65. Now, here is something that trips people up all the time. Medicare eligibility at 65 has nothing to do with when you claim Social Security. These are 2 completely separate programs with 2 completely separate timelines. You can be 62 and collecting Social Security and still not be eligible for Medicare. You become eligible for Medicare at 65, period. To qualify, you or your spouse generally need to have worked and paid Medicare taxes for at least 10 years. That's 40 calendar quarters. If you spent most of your career in the workforce, you almost certainly meet that requirement. But here's the part most people miss. Medicare is not something that just happens automatically. In most cases, you have to sign up. And if you sign up late, you can face penalties that follow you for the rest of your life. We'll talk more about that in just a few minutes. Now, let's break down the 4 parts of Medicare, because this is where most of the confusion lives. Think of Medicare as coming in 4 pieces: Part A, Part B, Part C, and Part D. Each one covers something different, and understanding what each part does is the foundation of making smart decisions about your health care in retirement. Part A, hospital insurance. Part A covers inpatient hospital stays, care in skilled nursing facility, hospice care, and some home health services. The good news is that most people pay $0 per month in Part A premiums, as long as you or your spouse worked and paid Medicare taxes for at least 10 years. So for most retirees, Part A is essentially premium free. But here's the important distinction. Premium free does not mean cost free. Part A still has a deductible for each hospital benefit period. And there is coinsurance if your hospital stay extends beyond a certain number of days. So while you may not have a monthly bill for Part A, you can still have significant out-of-pocket costs if you need hospital care. Part B, medical insurance. Part B is what covers your everyday medical needs: doctor visits, outpatient procedures, preventive screenings, lab work, and durable medical equipment like wheelchairs or walkers. Unlike Part A, Part B always comes with a monthly premium. The standard premium in 2026 is $202.90 per month. But, and this is important, not everyone pays the standard amount. If your income exceeds certain thresholds, you'll pay a surcharge on top of that standard premium. That surcharge is called IRMAA, the Income Related Monthly Adjustment Amount. I'm going to dedicate an entire video to IRMAA because it catches so many retirees completely off guard. But for now, just know that your retirement income planning directly affects what you pay for Medicare. That connection is critical. Part B also has an annual deductible, and after you meet it, Medicare generally covers 80% of approved costs. That means you are responsible for the remaining 20%, and there's no cap on that 20% in original Medicare. That is a risk a lot of retirees don't fully appreciate until they need a major procedure. Part C, Medicare Advantage. Part C, also called Medicare Advantage, is an alternative way to get your Medicare benefits. Instead of going through the federal government directly, you enroll in a plan offered by a private insurance company that's been approved by Medicare. Medicare Advantage plans must cover everything that original Medicare covers, but most of them go further, bundling in Part D drug coverage and adding extra benefits like dental, vision, and hearing, which original Medicare does not cover at all. These plans can look very attractive on the surface, especially when you see plans advertised with low or even zero monthly premiums. But there are trade-offs. Medicare Advantage plans typically require you to use a specific network of doctors and hospitals. If you go outside that network, your costs can increase significantly, or the plan may not cover those services at all. We'll talk more about how to choose between Original Medicare and Medicare Advantage in just a moment. Part D, Prescription Drug Coverage. Part D covers prescription drugs. If you stay with Original Medicare, Parts A and B, Part D is a separate standalone plan you add on through a private insurer. Here's the thing with Part D. The plans vary a lot. Different plans cover different medications, charge different premiums, and have different copay structures. This means shopping your Part D plan carefully every single year during open enrollment is not optional. It's essential. The plan that worked best for you last year may not be the best fit this year if your medications changed or the plan's formulary changed. Now that you understand the four parts, let's talk about the choice that every person turning 65 has to make: Original Medicare or Medicare Advantage. With Original Medicare, that's Parts A and B together, you have the broadest possible access to healthcare providers. If a doctor or specialist accepts Medicare, you can see them anywhere in the country. No referrals required. No network restrictions. The downside is those coverage gaps we talked about. The 20% coinsurance with no out-of-pocket maximum. Most people who choose Original Medicare pair it with a Medigap plan, also called a Medicare Supplement plan, to fill in those gaps and give themselves more predictable health care costs. Medicare Advantage, on the other hand, often has lower upfront costs, sometimes a $0 premium, and bundles in extra benefits. That can make it look like the better deal on paper. But the trade-off is that you're working within a network. You may need referrals to see specialists. And if you travel or spend time in multiple states, network restrictions can become a real problem. Here is one thing I want you to hear clearly. The decision between Original Medicare and Medicare Advantage has long-term consequences. If you go with Medicare Advantage and later decide you want to switch back to Original Medicare and add a Medigap plan, you may be subject to medical underwriting, meaning the supplement company can deny you coverage or charge you more based on your health conditions. That's not the case when you first enroll at 65. This is a decision worth getting right the first time. And it's one of the reasons having a conversation with someone who understands the full retirement picture, not just health insurance in isolation, is so valuable. All right, let's talk about the 3 biggest mistakes I see people make over and over again and how you can avoid them. Mistake number 1, missing your initial enrollment window. When you turn 65, you have what's called an initial enrollment period, a 7-month window that starts 3 months before your 65th birthday month and ends 3 months after it. If you miss this window and you don't have other qualifying coverage, like coverage through an active employer, you'll face late enrollment penalties. For Part B, that penalty is 10% added to your premium for every 12-month period you were eligible but didn't enroll. And that penalty does not go away. It stays with you permanently for as long as you have Part B. The same concept applies to Part D. Every month you go without creditable drug coverage adds up to a penalty that gets folded into your premium forever. Mark your calendar, know your window, don't miss it. Mistake number 2, assuming Medicare covers everything. This one catches a lot of people by surprise. Original Medicare does not cover routine dental care. It does not cover vision exams or glasses. It does not cover hearing aids. And it absolutely does not cover long-term care, things like assisted living or custodial care at home. These are significant gaps. A single hearing aid can cost thousands of dollars. Dental work in retirement can run into tens of thousands. And long-term care costs? Those can be financially devastating without a plan in place. Understanding these gaps before you retire gives you time to address them. Waiting until you need the care is too late. Mistake number 3, ignoring IRMAA. This is the one that surprises high-income retirees the most. IRMAA stands for the Income Related Monthly Adjustment Amount, and if your income exceeds certain thresholds, the federal government adds a surcharge to your Part B and Part D premiums. In 2026, those surcharges can add hundreds of dollars per month on top of your standard premium. Here's what makes IRMAA especially tricky. It's based on your income from 2 years ago. So the financial decisions you make today, things like Roth conversions, when you take Social Security, how you structure withdrawals from your retirement accounts, can directly affect what you pay for Medicare 2 years down the road. This is exactly why retirement income planning and healthcare planning cannot be done in silos. They have to work together. Medicare is one piece of the retirement puzzle, and it's a big one, but it doesn't stand alone. How you structure your income, when you claim Social Security, how you manage your taxes and your retirement account withdrawals, all of those decisions connect directly to what you pay for health care and how much of your retirement income you actually get to keep. If you'd like to learn more, take a look at the free booklet called Retire Smart. It's available on the page that's linked in the description box. And if this video helped you make sense of Medicare, do me a favor, give it a thumbs up and subscribe to the channel. Every week I'm here breaking down topics just like this one in plain language because you deserve a retirement that's secure, sustainable, and simplified. I'm Shonda Prescott, and this is Retirement Security Simplified, where we specialize in turning confusion into confidence, one conversation at a time.